Hey everybody, welcome back. Today we're doing a deep dive into some pretty cool marketing ideas for home health hospice and private duty home care,
Right.
specifically for March.
Okay.
Now, this isn't going to be your typical generic, you know, marketing advice.
No.
This is going to be a deep dive into a calendar
Yeah.
that is packed with unique events and opportunities.
Interesting.
And it's like having a secret weapon, to help you stand out
Right.
in a crowded market.
Yeah. What I find so fascinating about this calendar is that it encourages us to think differently about marketing.
Okay.
Instead of just blasting out a message to everyone, we're
Right.
going to be laser focused on connecting with specific groups of people
Okay.
and building those relationships in a meaningful way.
I love that. So are you ready to kind of unpack this calendar week by week
Yeah.
and see what gems we can uncover?
Absolutely. Let's dive in.
Okay. Week 9 focuses on, wait for it, social workers.
Oh, interesting.
Now, that's not who usually comes to mind when we think about,
Right. Marketing home health or hospice services.
It might seem a little surprising at first, but think about it. Social workers are on the front lines.
Okay.
They're connecting patients with the resources they need.
Right.
They're the gatekeepers to a whole network of potential clients.
So we're not just thinking about immediate referrals. We're
Right.
thinking about building long-term relationships with these key players.
Yes.
And the calendar even suggests some fun ways to do this, like sending thank you cards
Right.
or small gifts
Yeah.
to show appreciation for their hard work. I mean, who doesn't love a thoughtful gesture?
It's those little things that can make a big difference.
Right.
Building goodwill goes a long way, especially in a field like healthcare where trust and relationships are paramount.
Absolutely. And speaking of trust, there's this idea in the calendar about promoting the Give an Hour campaign,
Okay.
which provides mental health support for service members. It struck me as a really clever way to align your agency with a worthy cause.
While also connecting with social workers who are passionate about giving back.
It's a win-win.
Right?
You're showcasing your value, supporting a great cause, and building rapport with social workers all at the same time.
Right.
It's also a subtle reminder of the emotional and mental health aspects of caregiving, which are often overlooked.
That's a really good point.
Yeah.
And then there are some more practical ideas like reminding discharge planners
Okay.
about those free continuing education courses on things like cultural competence in end-of-life care. I mean, who doesn't love free professional development, right?
It's a smart move.
Yeah,
You're providing something of value
right,
while positioning yourself as a thought leader in the field.
right.
It's about being a resource,
Yeah.
not just a service provider.
And then there's this idea that I absolutely love tag-along presentations
Oh, yeah.
at long-term care facilities where you team up with a social worker to talk about the benefits of home health or hospice. It's a chance for collaboration and visibility.
I love that one, too. Yeah. You're leveraging each other's expertise and networks to reach a wider audience.
Right.
It also helps to build trust and credibility when you're presenting alongside a respected social worker who can vouch for your services.
So before we move on to week 10, let's pause for a moment.
Okay.
Imagine you're putting these ideas into action. How could you adapt them to your own network and community?
Think about the specific needs and challenges of your community.
Right.
Are there any local organizations or initiatives that you could partner with?
Okay.
What events or conferences could you attend to connect with social workers?
Great questions to consider. All right, moving on to week 10.
Okay.
This week is all about Patient Safety Awareness Week. Now, this one seems like a no-brainer for home health, right?
Absolutely. Patient safety should always be a top priority.
Right.
But especially in the home environment where there are unique challenges and potential hazards.
And by highlighting your expertise in this area, you're not only demonstrating your commitment to patient well-being, but you're also building trust and credibility with potential clients and their families.
Yeah.
It's like saying, we take your safety seriously and we know what we're doing.
Exactly. And there are so many ways to showcase your expertise during Patient Safety Awareness Week.
Right.
The calendar suggests everything from teaching a fall prevention class to hosting a coffee discussion where you actually invite past clients and their families to share their safety concerns.
Yeah, that's an interesting twist. Instead of assuming you know what matters most, you're getting direct insights from the people you serve.
Right.
That's a powerful way to build trust and show that you truly care.
It also shows that you're constantly learning and striving to improve.
Okay.
You're not just saying, we're the experts.
Right.
You're saying, we're always listening and learning from our clients.
I love that. It also reminds me of that saying, people don't care how much you know until they know how much you care.
Exactly. And speaking of caring, the calendar also emphasizes the importance of internal training, like making sure your CNAs and PCAs are up to date on lifting techniques and patient supervision.
Okay.
It's a subtle but important way to demonstrate that you're just as committed to staff safety as you are to client safety.
And it sends a message that you're investing in your team.
Yes.
Which ultimately translates to better care for your clients.
Absolutely. There's also this great idea about partnering with a therapy clinic for a presentation on walking aids. What a smart way to cross-promote your services and reach a new audience.
It's all about collaboration and leveraging each other's strengths. And don't forget about those emergency care plan flyers. Placing those in strategic locations.
Yes.
Like urgent care centers or assisted living facilities, can be a surprisingly effective way to reach potential clients at a moment when they're likely thinking about home health services.
It's about being in the right place at the right time with the right message. And speaking of the right message, the calendar also suggests launching a monthly newsletter with a disease management component. This is a great way to stay top of mind, build ongoing relationships, and position yourself as a trusted resource for health information.
It's like creating a little mini magazine packed with valuable tips and insights that people will actually want to read. It's a far cry from those generic marketing brochures that often end up in the trash.
It's about providing value beyond just your services. You're becoming a partner in your client's health journey, not just a provider.
All right, on to week 11. Brain Awareness Week. Now, how does this one connect to senior care?
This is where we tap into a growing area of concern. Cognitive health. With an aging population, awareness of Alzheimer's, dementia, and other cognitive issues is on the rise. And home health agencies are uniquely positioned to play a role in supporting individuals and families facing these challenges.
I'm starting to see the connection now.
You're already in the home providing care and support. You're in a prime position to notice changes in cognitive function. And offer resources and interventions.
So what does the calendar suggest for Brain Awareness Week? What are some concrete ways we can tap into this theme?
One idea is to get creative and co-sponsor art or literature competitions at a senior living facility, focusing on brain-related themes. This encourages engagement, stimulates cognitive function, and fosters a sense of community. Plus, it's just plain fun.
I love that. What a great way to get people thinking about brain health in a positive and engaging way. What else?
Well, there's the classic strategy of teaching a brain fitness class for seniors. This allows you to position yourself as an expert while building relationships with senior groups and organizations.
And it provides a tangible benefit to participants. Which is always a good thing.
Absolutely. The calendar also suggests donating customized crossword puzzle books with your agency's logo and contact info. It's a memorable giveaway that keeps your name in front of potential clients.
Clever. And I bet those puzzles get passed around too, extending your reach even further.
Exactly. Another interesting idea is to sponsor a lunch at a neurologist's office. This targets a specific referral source while providing a valuable service to the physician and their staff.
This tip from the calendar is just intriguing. Learn about the best time of day to give instructions to older adults. Now, why would that matter?
This speaks to the importance of understanding the nuances of cognitive function. Research suggests that certain times of day are better than others for information processing and retention, especially for older adults. By applying this knowledge, you can optimize your communication and ensure that your message is received and understood.
That is fascinating. It's a reminder that even small adjustments can make a big difference in how we connect with and care for our clients. Before we move on to the next week, what stands out to you from this Brain Awareness Week section?
For me, it's the emphasis on proactive engagement. You're not just waiting for people to need your services. You're actively promoting brain health and positioning yourself as a resource for prevention and early intervention. This forward-thinking approach can build trust, establish your expertise, and ultimately lead to stronger relationships with potential clients and referral sources.
Great point. All right, ready for week 12. This one is all about diabetes awareness, which the calendar reminds us is a huge issue, especially for seniors. They mentioned that over 23% of people over 60 have diabetes.
Wow.
That's alarming.
It is. And it highlights the need for proactive diabetes management and support.
Right.
This is where home health agencies can truly shine, providing specialized care, education, and resources to help individuals manage their condition and maintain their independence.
So what are some of the marketing ideas for Diabetes Awareness Week?
One suggestion is to host a diabetic-themed word search contest.
Oh, okay.
It sounds simple,
Yeah.
but it's a fun and engaging way to connect with referral sources and spark conversations about diabetes care.
Okay.
You could even partner with a local pharmacy or grocery store to host the contest and reach an even wider audience.
It's a lighthearted approach to a serious topic, which can be very effective in breaking down barriers and getting people talking.
Right.
What else?
Well, the calendar encourages participation in ADA-sponsored expos.
Okay.
This is a classic strategy,
Right.
but it's still highly effective for raising awareness, building relationships, and generating leads.
Right.
Think about it. You're surrounded by people who are already interested in diabetes care and management.
Right.
It's a prime opportunity to showcase your expertise and connect with potential clients and referral sources.
It's all about being in the right place at the right time, right? Putting yourself out there where those potential clients and referral sources are already looking for information.
Exactly. Another idea is to teach a diet and nutrition class at an assisted living facility.
Oh, okay.
This showcases your expertise in diabetes management while building trust and rapport with residents and staff.
And it addresses a very practical need, as proper nutrition is essential for managing diabetes.
Absolutely.
What about reaching out to doctors?
The calendar specifically recommends educating general practitioners about your agency's diabetic care services.
Okay.
GPs are often the first point of contact for individuals with diabetes, so
Right.
they're a key referral source. By providing them with clear and concise information about your services, you make it easier for them to connect their patients with the specialized care they need.
That makes sense. And there's this idea of placing diabetic zone flyers in hospital emergency rooms. Now, what's the thinking behind that?
It's about reaching high-risk individuals at a critical moment. Someone who ends up in the ER with a diabetes-related complication is likely in need of additional support and education.
Okay.
By providing them with information about your services right then and there, you plant a seed at a time when they're most receptive to help.
Okay.
It's all about strategic timing.
Smart strategy. It's all about being in the right place at the right time with the right message. The calendar also suggests sending personalized notes and service brochures to past patients.
Yes.
It's a simple but effective way to nurture existing relationships and remind people of the value you provide.
It's a great way to stay top of mind and potentially generate repeat business or referrals.
Okay.
And for a more community-focused approach, the calendar recommends teaming up with other providers for a Step Out Walk to Fight Diabetes event.
Cool.
This not only raises awareness, but also fosters a sense of camaraderie and collective action, which can be very powerful.
That sounds like a great way to build community relationships and generate positive PR for your agency. It's a reminder that marketing doesn't always have to be about direct selling. Sometimes it's about creating experiences, fostering connections, and building a reputation for caring and commitment.
Right.
All right, before we move on to our final week,
Okay.
let's pause for a moment.
Okay.
What are some of the key themes you're noticing in these marketing ideas so far?
I'd say there are a few that stand out.
Okay.
First, the focus on building genuine relationships. It's not just about transactions.
Right.
It's about connecting with people on a deeper level, understanding their needs, and providing value beyond just your services.
Right. It's about being a partner, not just a provider.
Secondly, I'm seeing a lot of emphasis on education and thought leadership.
Okay.
By sharing your expertise, you position yourself as a trusted resource
Right.
and build credibility in the community.
It's about demonstrating your value, not just talking about it.
Exactly.
Right.
And finally, I'm noticing a trend towards creativity and thinking outside the box.
Go on.
These marketing ideas aren't just the same old tired strategies.
Right.
They're fresh, engaging, and tailored to the specific event or awareness campaign.
That's what makes this calendar so interesting.
Yeah.
It's packed with practical ideas that you can actually use.
Absolutely. And it encourages you to think creatively and find opportunities to connect with your community in meaningful ways.
Okay. So we've explored some really creative ways to make the most of March with some pretty unique awareness campaigns and events.
Right.
But wait, there's more.
Oh.
Our March marketing calendar also includes a bonus section
Okay.
that highlights even more opportunities, even if they're not directly tied to home health hospice or private duty care.
What I find so exciting about this bonus section is that it encourages you to think outside the box.
Okay.
It's all about connecting the dots between your services and what's happening in your community.
Yeah.
Even if the connection isn't immediately obvious.
It's like a challenge to flex those creative marketing muscles.
Right.
So let's jump into these bonus opportunities.
Okay.
First up is American Red Cross Month.
Okay.
Now, how could a home health agency tap into that? It doesn't seem directly related to what we do.
You're right. It's not a direct link, but there's definitely potential for partnership and collaboration.
Okay.
Imagine hosting a blood drive at your office or sponsoring a Red Cross event.
Okay.
You could even simply promote their services in your marketing materials.
So it's more about aligning your brand with a well-respected organization.
Right.
And showing your commitment to the community as a whole.
Exactly. It's about demonstrating your values and reaching a wider audience.
Okay.
Plus, it's a great way to generate positive PR.
Okay, what about National Colorectal Cancer Awareness Month? That one seems a bit more specific, but still not directly tied to home health.
True, but it offers a chance for some really targeted outreach. Think about it. You could partner with a local hospital or cancer center to offer educational materials or presentations on colorectal cancer screening and prevention, especially for seniors.
So we're focusing on the preventive side of healthcare, which absolutely ties into the overall mission of home health.
Right.
We're helping people stay healthy and independent in their homes.
Precisely. You're positioning yourself as a valuable resource.
Right.
Even before someone might need your services.
Right.
You're showing that you're committed to the well-being of your community.
Okay. I see how that works. What about National Kidney Month?
This is a prime opportunity to highlight any specialized services you offer for patients with kidney disease.
Okay.
Maybe you have nurses who are specifically trained in renal care.
Right.
Or you offer in-home dialysis support.
So it's about really honing in on a specific niche within the broader healthcare market.
Exactly. It's about demonstrating your specialized knowledge and attracting clients who are looking for those very specific services.
All right, and last but not least, there's National Nutrition Month.
Right.
How could a home health agency tie into that one?
This one's a natural fit.
Okay.
You could promote your dietary services.
Yeah.
Offer healthy cooking classes for seniors and their families.
Right.
Or share tips for maintaining a balanced diet.
It's a great way to showcase the expertise of your dietitians or nutritionists and highlight the importance of nutrition for overall health and well-being, especially as we age.
And it's a topic that resonates with a wide audience.
Yeah.
Not just those who are currently receiving home health care.
Okay, so we've covered a lot of ground here with this March marketing calendar. From social workers to brain health to diabetes awareness and even the Red Cross. It's been a whirlwind of creative ideas.
It has.
What are some of the key takeaways you want our listener to walk away with from this deep dive?
I'd say the biggest takeaway is to think creatively and be open to unexpected opportunities. Don't limit yourself to the obvious holidays or awareness campaigns.
Okay.
Look for those less obvious connections and find ways to tie your services to those broader themes or events happening in the community.
It's about thinking outside the box and finding those unique angles that will make your marketing stand out from the crowd.
Exactly. And remember that marketing is not just about selling your services.
Right.
It's about building relationships, providing value, and becoming a trusted resource in your community.
It's about being a partner in health and well-being.
Yes.
Now, before we sign off,
okay,
I want to leave our listener with a final thought-provoking question to ponder.
Okay.
What unique events or awareness campaigns happening in your area could you leverage for marketing your services?
Think about local festivals,
Okay.
community initiatives, or even hyper-local holidays that are specific to your region.
Okay.
Get creative.
Yeah.
Have fun with it.
Yeah.
And see what unexpected opportunities you can uncover.
That is such a great challenge. I love it. It's all about keeping those marketing muscles flexed.
Right.
And finding those creative connections.
Exactly.
Well, we've made it to the end of the calendar.
Okay.
But before we wrap up this deep dive completely, we have one more treasure trove of information to explore.
Ooh.
Remember how I mentioned at the beginning that our source material wasn't just a calendar,
Yes.
but also included some bonus tips on home health and hospice marketing.
Yes. And these tips offer valuable insights into the unique challenges and opportunities of marketing these specialized services.
Okay.
It's a chance to step back from the specific events and strategies we've been discussing and look at the bigger picture of how to effectively reach your target audience and build a thriving business.
All right, let's dive in. One of the first things that jumped out at me was this clear distinction between marketing and selling. They emphasize that marketing is about creating awareness, while selling is about converting that awareness into actual referrals.
It's a crucial distinction.
Yeah.
Often people use these terms interchangeably.
Right.
But understanding the difference is essential for developing effective marketing and sales strategies.
Okay.
Marketing lays the groundwork, building brand recognition,
Right.
and positioning your agency as a trusted resource.
Okay.
Selling is about closing the deal,
Right.
turning those potential clients into actual customers.
So it's like planting seeds versus harvesting the crops.
Precisely.
You need both for a successful garden.
And the source material highlights the importance of targeted marketing programs for home health agencies.
Right.
They often don't have the resources for those big, splashy mass market campaigns.
Right.
So they need to be strategic and focus their efforts on reaching the right people with the right message at the right time.
Right. It's about being laser focused and making every marketing dollar count.
Exactly.
They also talk about the importance of consistency. The marketing message needs to align with the agency's mission, vision, and services.
Absolutely. Consistency builds trust and credibility.
Right.
Your marketing materials, your website, your interactions with referral sources, and the care you provide.
Right.
It all needs to tell a cohesive and compelling story.
It's about creating a unified brand experience that reinforces the value you offer.
Right.
Now, when it comes to selling home health services, the source material has some interesting insights there, too. They talk about the need to train not only outside sales reps, but also inside staff on how to effectively sell the agency's services.
This is so important.
Yeah.
Every interaction with a potential client or referral source is an opportunity to make a sale.
Right.
Whether it's answering the phone, responding to an email, or scheduling an assessment, your team needs to be equipped to confidently articulate the value you provide and guide people through the decision-making process.
So it's not just about being friendly and helpful.
No.
It's about having those sales skills and closing those deals.
They also talk about the importance of educating clinical staff about the sales process.
Why would that be necessary?
Because nurses and other clinicians aren't always comfortable with the idea of selling healthcare services.
Right. They went into healthcare to help people, not to be salespeople.
Exactly.
Okay.
But by understanding the sales process and the role they play in it, they can feel more confident and comfortable talking about the benefits of home health care with patients and families.
So it's about empowering them to be advocates for the services they provide.
Precisely. And when everyone on the team is aligned and working towards the same goal, it creates a much more powerful and effective sales engine.
All right, we also have some bonus tips.
Okay.
Specifically for hospice marketing.
All right.
Now, this is an area where there can be a lot of misconceptions and sensitivities, right?
Absolutely. There's still a lot of stigma surrounding hospice care. And it can be a difficult conversation to have.
Yeah.
But it's a conversation that needs to happen.
The source material highlights the importance of educating the community about what hospice truly is. They suggest using clear and compassionate language. Focusing on the benefits of hospice and dispelling those common myths and misconceptions.
That's so important.
Yeah.
Hospice is not about giving up.
Right.
It's about focusing on comfort, quality of life, and supporting the whole family during a difficult time.
They also suggest partnering with other organizations that serve seniors, like senior centers, assisted living facilities, and churches.
Those are great places to start. You can offer presentations, host workshops, or simply provide informational materials. It's about building those relationships and establishing yourself as a trusted resource.
And they even suggest offering grief support groups for families who have lost loved ones.
That's a beautiful way to extend your care beyond the patient.
Right.
And show that you're truly invested in the well-being of the community.
Wow. This deep dive has been packed with insights. We've explored a calendar full of creative marketing ideas for every week in March.
Yes.
And we've delved into some bonus tips on home health and hospice marketing. that go beyond the calendar itself.
Right.
It's been a whirlwind of information. But what are some of the key takeaways you want our listener to walk away with?
I'd say the biggest takeaway is that marketing in home health, hospice, and private duty care is all about building relationships,
Right.
providing value, and being a trusted resource in your community.
Yeah.
It's about understanding the needs of your target audience and finding creative ways to connect with them.
It's about being more than just a business. It's about being a resource, an advocate, and a partner in health and well-being.
Exactly. And I think this March marketing calendar and the bonus tips we've explored provide a fantastic framework for doing just that.
I agree. It's a great reminder that marketing doesn't have to be complicated or expensive.
No, it doesn't.
It's about being thoughtful, strategic, and consistent in your efforts.
Absolutely.
Well, that brings us to the end of our deep dive.
Okay.
I hope you feel inspired, equipped to take your marketing to the next level.
Yes.
Remember, even small changes can make a big difference.
They do.
Thanks for joining us, and we'll see you next time. All right, so we've talked about the importance of training your team, both inside and outside sales staff,
Right.
to effectively communicate the value of your services.
Yes.
But let's get even more granular.
Okay.
The source material actually dives into some specific techniques for presenting home health services to potential clients and referral sources. They call it the 5 steps to presenting home health.
Yes, this 5-step process offers a really structured approach to presenting your services in a way that's both informative and persuasive. It's all about guiding the conversation, addressing concerns, and highlighting the benefits of home health in a way that resonates with the individual's needs.
Okay, I'm intrigued. Walk me through these 5 steps.
Okay.
What's the first one?
Step 1 is all about building rapport.
Okay.
It's about making that personal connection, showing genuine interest in the individual and their situation.
Right.
Remember, people choose to work with people they like and trust.
So it's not just about launching into a sales pitch.
No.
It's about establishing a foundation of trust and understanding.
Exactly. Step 2 is where you start to introduce the concept of home health.
Okay.
This is where you explain what home health is, the types of services you offer, and how it can benefit the individual.
Okay.
The key here is to keep it simple and focus on the value proposition.
So instead of overwhelming them with a laundry list of services, you're highlighting the key benefits and how they can address their specific needs.
Precisely. Now, step 3 is where you start to tailor the conversation to the individual situation. This is where you ask questions, gather information, and really listen to their concerns and goals.
It's about moving from a general overview to a more personalized approach.
Exactly. And this step is so crucial because it allows you to identify the individual's pain points and position home health as the solution.
So you're not just talking AT them, you're engaging them in a dialogue and showing them how home health can address their unique challenges.
Right. Now, step 4 is where you address any objections or concerns they might have.
Okay.
This is where you anticipate those common questions and have clear and concise answers ready.
So instead of shying away from those tough questions, you're proactively addressing them and building confidence in your services.
Exactly. And finally, step 5 is the close.
Okay.
This is where you summarize the benefits, reiterate how home health can help, and make a clear call to action.
So you're guiding them towards that decision point and making it easy for them to say yes to your services.
Exactly. It's a structured approach to selling.
Right.
But it's also about building relationships and empowering individuals to make informed decisions about their health care.
I love that. It's not just about closing a deal. It's about making a positive impact on people's lives. Now, the source material also has some specific tips for marketing hospice services.
Right.
And this is an area that requires extra sensitivity and tact.
Absolutely. There's still a lot of stigma surrounding hospice care.
Yeah.
And it can be a difficult conversation to have.
Right.
But it's a conversation that needs to happen.
The source material emphasizes the importance of educating the community about what hospice truly is. They suggest using clear and compassionate language.
Yes.
Focusing on the benefits of hospice.
Right.
And dispelling those common myths and misconceptions.
That's so important.
Right.
Hospice is not about giving up. It's about focusing on comfort, quality of life.
Right.
And supporting the whole family during a difficult time.
They also suggest partnering with other organizations that serve seniors.
Right.
Like senior centers, assisted living facilities, and churches.
Those are great places to start.
Yeah.
You can offer presentations, host workshops, or simply provide informational materials. It's about building those relationships and establishing yourself as a trusted resource.
And they even suggest offering grief support groups.
Yes.
For families who have lost loved ones.
That's a beautiful way to extend your care beyond the patient.
Right.
And show that you're truly invested in the well-being of the community.
Wow, this deep dive has been packed with insights.
It has.
We've explored a calendar full of creative marketing ideas for every week in March.
Yes.
And we've delved into some bonus tips on home health and hospice marketing that go beyond the calendar itself.
Right.
It's been a whirlwind of information. But what are some of the key takeaways you want our listener to walk away with?
I'd say the biggest takeaway is that marketing in home health, hospice, and private duty care is all about building relationships, providing value.
Right.
And being a trusted resource in your community.
Yeah.
It's about understanding the needs of your target audience.
Right.
And finding creative ways to connect with them.
It's about being more than just a business. It's about being a resource, an advocate, and a partner in health and well-being.
Exactly. And I think this March marketing calendar and the bonus tips we've explored provide a fantastic framework for doing just that.
I agree. It's a great reminder that marketing doesn't have to be complicated or expensive.
Right.
It's about being thoughtful, strategic, and consistent in your efforts.
Absolutely.
Well, that brings us to the end of our deep dive.
Okay.
I hope you feel inspired and equipped to take your marketing to the next level.
Yes.
Remember, even small changes can make a big difference.
Absolutely.
Thanks for joining us. And we'll see you next time.